Good afternoon and welcome to Webinar Wednesday. Today we are joined by Joe Stockman, Director of Product Experience, Chris Lang, Vice President Product and Strategy, and Kevin Lund, Solutions Engineer at FSI. Webinar Wednesday would like to thank our sponsor FSI. FSI is a healthcare CMS EAM provider. So to learn more about FSI CMS's extensive product suite and services, please visit fsiservices.com. Now, just a reminder about saving the date for our Fall MD Expo. We're headed to the Mohican Sunrook Casino and Resort in Connecticut from October the 8th to the 10th. Please join us for 3 days of education, networking, and the latest advances in medical technology, product and services. For more details, please visit mdexposhow.com. Now, TechNation celebrates HTM professionals every day, but the magazine is doing something special for HTM Week this week. Each weekday, one lucky biomed will win a $100 gift card via a contest sponsored by Healthmark Industries. So how do you win? It's simple. Go to onetechnation.com/HTM Week contest and fill out the form. Entries will be accepted through the end of HTM Week, so that's May the 25th. Now, each day a winner will be announced on social media, so please follow TechNation on Facebook and LinkedIn to see if you win. Today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our Webinar Wednesday 10th anniversary prizes. Today's prize is a $100 Amazon gift card. So using the questions feature on your dashboard, let me know the answer to the following trivia question. May is Lupus Awareness Month. What colour is associated with lupus awareness? I'll reveal the answer and our winner at the end of the webinar. We'll be wrapping up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Joe Stockman, Chris Lang and Kevin Lund, and they will be discussing navigating the asset lifecycle from standardization, maintaining compliance to capital planning. So Kevin, you may begin whenever you're ready.
Thank you very much. Hello, everyone, and happy HTM Week. Welcome to FSI's presentation on navigating the asset life cycle. Let's begin our presentation with a brief overview of our agenda. We're going to begin with some introductions. We're going to discuss and define asset management, review the importance of standardizing your asset data, what you can do to ensure regulatory compliance, planning for future capital expenditures, and finally, a Q&A session to round out our discussion. So let's begin with some introductions. Again, my name is Kevin Lund. I've been affiliated with HTM for approximately 45 years in various roles. I began in healthcare as a technician, then moved into management. I've supported multiple CMMS software applications, plus provided support for medical manufacturer and third-party service providers. Currently at FSI, I'm partnering with customers to ensure CMS is supporting their operational and regulatory goals. Now I'll pass it over to Chris.
Thank you, Kevin. So my name is Chris Lang. I'm Vice President of Product and Strategy at FSI. I've been in healthcare CMMS and EAM software for a little over 16 years. My role here is to work closely with clients to help solve issues and workflow problems that they have on different product features within our application suite. And I also work closely with our partners, providing robust integrations and enhanced workflows via tighter partnerships. Joe?
All right, thanks, Chris. Joe Stockman, I'm the Director of Product Experience here at FSI. I've been with FSI for over 20 years, and I have about 29 years of experience with healthcare CMMSs. What I currently do is I work with our customer base And we really try to solve problems in the with our customers, daily lives. We like to say in our product department, your job is not to use our product. Your job is to do your job and repair equipment, and make sure that the safe environment of care for your patients. This is just a tool that we have that is supposed to help you along with those things. So we take that into every decision we make in our product when we're building them. So, let's move on. All right, so asset management, what is it? That's sort of the big elephant in the room with all this equipment out there. And it refers to what each organization does to store, locate, maintain, and keep track of the physical assets at your locations. Everything from your infusion pump, which roam around, to MRI machines that hopefully don't move around, but they're all in place there. And they're essential to healthcare operations. The HTM group, the biomeds, they're directly responsible for the equipment that keeps patients alive. So all asset management systems aren't equal, but when managing this type of equipment, we do want to be mindful of a couple of things. We'll keep that in mind as we talk about the agenda with standardization, compliance, and then capital planning. If you don't do it right, it can cost money. So there's a huge advantage in doing the managing your assets appropriately. There's an estimate there. It's kind of eye-opening that approximately $14 billion is lost in productivity just for nurses searching for equipment that they can't find. So if you don't have a system in place of where that equipment's located, how to get it to the nurse in a timely manner, how to repair it in a timely manner, it can cost money. It could cost potentially lives if they take roughly an hour per shift to get that equipment. So you might lose the equipment if you don't know where it is, or people take it, or it gets transferred to another hospital, or if you're not maintaining it because you can't find it, you might be doing more in emergency repairs. And finally, you might be overbuying equipment because you don't know what you have. If you don't have a good inventory, how do you know what you need or what you don't need? So it all ties together with tracking and planning for the future within your hospital. So if you do it correctly, your lives will definitely be easier. You'll be more efficient, and your patients, which is the biggest thing, that the number one item on there that we try to keep in mind is better patient care. A positive outcome, having equipment that works, things that aren't alarming or having to be replaced, definitely makes it easier on the patient experience within your hospital. And that patient experience obviously goes right to your bottom dollar with your patient experience rounding. You're also able to, if you're maintaining it properly or looking at it on a regular basis, which you should be by code, you're not going to replace that equipment as often. It's going to have longer lifespans. You can keep that equipment functioning longer within the hospital. Some things you replace just because there's newer and better and shinier objects out there, but some of that equipment's still useful throughout the hospital, especially during surges and those types of things. And then finally, on the budget side, if you keep losing the equipment or can't find it, or you do have to replace that equipment at some point, so it makes it easier to plan your budget. And also, if you're tracking repairs and how often you're putting parts into that piece of equipment, what the cost of ownership of that particular item is, you can better budget for maybe one or two things do need replaced, or the value of that high dollar equipment isn't worth the contract that it's under. So there's lots of different things you could do in capital planning when managing your assets. So with that, we are gonna flip it back to Kevin to talk about standardization.
Thanks so much, Joe. Standardization. Yes, let's begin our discussion here by reviewing 5 standardization components. The most important aspect of standardization is asset naming. We have to identify those assets, dealing with asset categories, course manufacturers, and the models as well. Now, as you know, one way for manufacturers to grow these days is to purchase others to gain their technology. Who owns and supports what technology is important, because it's changing constantly, it seems like. I want to emphasize during this presentation the importance of eliminating as much free text as possible regarding your assets. And then standardization also leads to consistency in other areas of your operations, which we'll be reviewing as well. And finally, the importance of standardization when it comes to using your mobile devices in the field, something that is becoming more and more important every day. So let's start with our asset naming, or what we call our asset categories. It's important to have a structure set up. Now you can use standards that exist today, like ECRI has the UMDNS, and there are other organizations out there as well. Now you can also develop your own standards that meets your own organization's personal needs. Now you can be able to do this and by creating what's called a hierarchy with your asset naming. So you can have pumps, for example. Well, you have pumps, but you have infusion pumps. Well, you have different types of infusion pumps, high volume, PCAs, syringes, etc. But when you're doing this, make it easy and intuitive so that it's easy to add on to your categories so that you have a standard moving forward. Now, as we discussed earlier, manufacturers are changing, they're transitioning constantly. Now, this has been some time ago, but Datex Omeda was a company out there that was purchased by GE Healthcare. Now, what we can do there is we can now be able to put a process in place to be able to manage those companies that GE has purchased. So we start out by creating our GE Healthcare manufacturer, but then we can now be able to add on the companies that GE has purchased. So for example, here we have GE Healthcare / Datex Omeda, one manufacturer record with all the associated models that relate to that, with one address as well. So you know that division to contact. You can create those categories that are identified to those assets, but no matter what name is on the asset, you're still able to identify in your CMMS what record or what manufacturer to utilize. I can't emphasize more the importance of eliminating free text data entry. Now, here's just a partial example of what infusion pumps can look like for a customer that's using free text. It gets really over the top trying to figure out who the correct manufacturer is, what model is being used, and also what category is being used to identify that asset. So what we can do is, by standardizing that data, we now can be able to have a much easier view of our manufacturer, which could be a transition in this case. We have the model numbers and names, and then a very standardized category list associated with those. So no matter the name on there, we can now be able to search and find that particular asset. Now, when we get into standardization as well, there's other components we need to be aware of. First off is dealing with our PM scheduling. Of course, we have our risk assessment associated with that. And risk assessments can be done at the model level. They can also be done as a default to the asset category level. And then finally, being able to assess and schedule at the individual asset record level as well. So you can now be able to have a hierarchy of how you assess and schedule all your assets. Now, for someone like myself who's been in the healthcare or HTM market for a long time, being able to utilize OEM and AEM protocols is very important. But you also then need to be able to show how you justify the use of those AEM protocols. Without a standardized methodology of evaluating your assets, you cannot be able to fully be able to ensure that you have, really are able to adopt that ADM protocol. And in many cases, what I like to do when I'm doing that is compare my corrective maintenance to my preventive maintenance numbers so that I can better identify if I can justify an AEM. Now, of course, also when it gets into hazard recalls get to be very manufacturer model specific and even serial number specific. But again, without that manufacturer model standardization, it makes it very difficult to ensure that you're identifying all your assets relating to those hazard recalls. And here's an example of that. Again, also with your mobile documentation, this can be very important to be able to identify your particular assets in the field, who the manufacturer, model, and category is, and of course their associated location. So you can be able to do that on your smartphone or your tablet and be able to see that information. Now with FSI, we can be able to take that information as well and also put it onto your floor plan. So not only do you have a location, but you can actually see it directly on your floor plan so you know where to find that particular asset. So again, overall standardization has a wide range of items that can help you in the long run within your operations. So now I'm going to pass it back to Joe.
All right, thanks, Kevin. So we're going to talk about compliance and sort of what you need to do to make sure you're ensuring compliance in your organization. So I put together this checklist to sort of help you along. And the first thing in this checklist is know your standards. What are you doing? What are the standards you're adhering to with your authority having jurisdiction? That's your AHJ. That could be one of the regulatory agencies out there. We'll talk about that in a second. I have the next item there is accurate inventory. And I jokingly put the important AI. A lot of talk about AI, but without an accurate inventory, you really don't know what you're maintaining. You have to know you have it in order to maintain it properly and track that you're maintaining it properly, more importantly. Next is the procedure compliance. All of those assets, are they all scheduled appropriately? Do you have the right procedures on them? And do you have a way to check that and ensure that that's happening as you continue to add assets or take assets out of service? Are you managing that process appropriately? Kevin mentioned OEM versus AEM. There are certain types of equipment you're not able to do AEM on. You have to do the original equipment manufacturer recommendations. You can't use that alternative one for certain types of equipment. So you need to know which ones those are. Finally, on the reporting side, you're doing all this work, you're documenting all this work, hopefully, and then how do you get that information back out of the system with reporting? How do you make sure you have all that information? And then where are you storing that information? Is it in, are you printing it out and putting it in binders? Are you storing it on a SharePoint site? Is it all in one place? That's sort of the more important question. What you don't want to have happen during document review is being, oh, that's not in this one, it's in this other room, or this is somewhere else, or I can't find it in this folder. You want to make sure you're making that process as streamlined as possible as you're going through that checklist. So next, we're going to talk about the different regulatory agencies. And some of you don't get to choose who that agency is. Some of it's chosen for you, usually by a hospital administrator. But there are a number of different agencies out there. There is the big one, the big elephant in the room, Joint Commission. I was trying to find numbers on the percentage of these used. I would think it's overwhelmingly Joint Commission based. And they started in 1951. So they're the oldest ones that are for at least hospital accreditation that are out there. Then there's HFAP, also ACHC kind of merged together. That started in 1965. DNV, they've actually been around a lot longer, but they've only been doing U.S. healthcare accreditation since 2008. but they've been around since like 1864 or something, doing like boat inspections or something. So that's probably the second largest one that I see out there. Is DNV is next, and then there's a relatively newcomer on the block, not as new as DNV, but CIHQ out of Texas. They're doing some accreditation. They started in 1999 doing their hospital accreditations, and so there's a couple of different choices out there, and that's going to lead us to our poll question that we have. This is just more for our curious, and yeah, you'll be able to vote here in a second. But which regulatory agency do you use? Is it the Joint Commission, DNV, or another one? I put the top two in there for. So let's go ahead and vote. I can't vote, or I'd be voting.
Okay, I'll give the attendees a couple more seconds. And
yeah, thank you.
Okay, I'm going to close the poll.
All right. We should have took steps earlier on what it was.
Yeah.
All right. So yeah, awesome. So 70% are using Joint Commission, and close to 20 are using DNV. I'm surprised that the others 11. That's probably the highest I've seen in the polls I've done and looking around. So be interesting to see what those might be. So cool. Thank you. All right, so looking at those different ones, I pulled some examples of the sections in the code books. I don't know if they're books anymore, but on the Joint Commission. So, you know, ECO 204-03 is where the Joint Commission defines the inspection, testing, maintenance of medical equipment in their environment of care section. DNV has it under PE.7 for your medical equipment management system. CIHQ has it in CE-8. :Q, lots of different sections and subsections on there. And then, you know, if you have another authority having jurisdictions, you know, particularly at the local or state level, and within HTM, they're typically the same requirements at all the levels. We also do work in healthcare facilities as well, where they do have some stricter local and state requirements based on different things in a hospital. So. But primarily, if you're following the national ones with HTM, you're probably in good shape. But I don't know every state's in local jurisdiction out there, so just keep that in mind when you're adhering to these standards. And that's sort of step one, is knowing what you're adhering to. So. All right, moving on. The next one is the asset inventory. And the ITM cycle. ITM is your inspection, testing, and maintenance program. That's what you're doing with equipment. You're inspecting it to make sure, you're testing it to make sure it's given the right dosages. You're maintaining it, fixing it if it's not. You know, getting the asset inventory. And I have that that's easy. You know, getting the asset inventory isn't as tricky as it sounds. It's probably the easiest component of this. So as you go through that and get that asset inventory, the next step is scheduling your ITM. You know, when are you doing that? Are you doing it by category? Are you doing it by category, cost center, or department? Are you doing sweeps? Do you have certain types of equipment each month? Do you break it down? And it probably varies based on the size of your hospital. Some hospitals have a very small, you know, smaller hospitals might only have 2 or 3 biomeds doing all this equipment. So they're kind of just maybe doing departments and doing everything in that department in January, then everything in a different department in February. Some might be doing sweeps by type of equipment, where you're going in everywhere once a month and doing the sweep on all your infusion pumps, and then you're doing other types of equipment. And then you're locating that equipment. You have to find that equipment. That's part of the problem. Once you find it, you go ahead and perform that ITM. And part of performing that ITM, you know, you might have some questions in there, and I have some recommendations coming up of how are you doing that? Are you evaluating that piece of equipment? What is the life of that? Do you have to reschedule it based on, hey, this is an older piece of equipment, so maybe we should be maintaining it once every 6 months instead of once every year? Same thing on a corrective. If you find yourself doing more correctives on a piece of equipment and can't afford to replace it, maybe you do want to increase the frequency on those types of things. So, you know, it's a constant, you know, you're constantly evolving, you're constantly working with this. You go ahead and, you know, replace that equipment if it needs to. If you do repair or replace, you have to go through and make sure you schedule that new piece of equipment and perform the incoming inspection. And then finally, you know, verify that it's there, verify that's in place. What's your process if you don't have it, you can't find it? Does it need to go back into inventory? And just as a note here, you're never complete with this process. From the minute you do your asset inventory, okay, maybe 5 minutes, it becomes inaccurate once things start moving around, once things get out of service, once things disappear. You don't know when something walked out the door, especially with the movable equipment. It's part of the process. It's something you just want to make sure you have your own process in place for this. So that's the recommendation. We'll talk about a few examples that we've done in our software that can help, and these can be done in multiple software too. But next, Kevin alluded to this earlier, is where's that equipment located? You need to know where that equipment is, and if you can make it easier to find, maybe you have a real-time locator software in place, RTLS as it's commonly known, that has the RFID tags on the equipment. It's something we can interface with those types of companies to represent where those assets are in our product. We call it CMMS View. And CMMS View lets you see on the floor plan where all that equipment is located, where the work is to be done, and you could just click on an icon to pull up that work order and go ahead and complete that, do the inspection on it. But if you could save yourself time finding that equipment, we had the number on the nurses locating equipment. What's that number for you guys? How much time are you spending looking for equipment? Is it worth it to invest in a system like that? Once you are doing that inspection, one, is it still there? If you're looking for it and you don't have an RTLS and you look for it 2 or 3 times, can I find it? If I do that and you're unable to locate that, what do I need to do to that asset? How many times do I need to look for that before I take that asset out of service or mark that as can't find? If you do find it, again, you're doing an assessment of what is the condition of that asset. Does it something that needs replaced? And if it does, how do you flag that and how do you put that on a list that goes up to Chris's section next, that it's in poor condition or something along those lines, or it might need replaced. So you might lose that piece of equipment. I have an MRI machine up there with I can't find the MRI machine. If you can't find the MRI machine, then you got bigger problems than other equipment. But if you could build that into your PM process or into your repair process, on the next slide, I show an example of what that might look like. And what this does, and I've worked with biomeds and walked around, and they literally do carry that little, Mead notebook, the spiral notebook, and that they're unable to locate procedures. They write down the asset number and they make a list of what they're going to go look for next month and what they're going to go look for 2 months from now, when they can't find it. That's how it's being done. So how do you make it smarter? How do you empower those BETs to let other people know that maybe they need to take that out of service or do something or create a new work order to find it next month rather than keeping it on paper? How do you use your CMMS to track that information? So just adding a couple questions to your procedure, is the asset able to be serviced at this time? Yes or no? Maybe it's you can't find it or it's hooked to a patient, and then that triggers other things to happen within the system. Also, we could update the asset's condition right from the work order by providing the assets condition drop down where that is. We could also, update other asset information right during that workflow as well. So, I have it marked as an example, and these are things defined by different hospitals. Put it up for replacement. Parts and service are no longer available. So if you're repairing something and you just can't find the parts for it, make sure you update that, because that's definitely a need that you might need to replace that. And those conditions, if you're assessing them and setting them on a regular basis with your own group, you're constantly keeping that up to date, so you're ready to go into that capital planning session, when it's time for budgeting. Next, I talked about the procedure compliance. Is the asset scheduled? That's an easy one. Like, hey, I could do a search on all my assets to see if they have an ITM or a PM scheduled on them. However, can you check and see if it's using the correct procedure? Do you have methods to set and check that? I could put a imaging procedure on a infusion pump, and technically it's scheduled, but it might not be the right schedule. So you do want to make sure you're doing that and scheduling it correctly. And those are things you could check on using some other tools. We had some tools created and looking at through our analytics package, which show us those things. But that's a common thing, and it could be by error. It could be somebody didn't have it categorized correctly. That's the importance of the standardization, making sure you have categories that are standard, because this helps you set this up. If you have a great list of asset categories, you could tie procedures to those and tie procedures to the models to know that you're getting the correct procedures added to that equipment. So next I show the example of that. We have some items that when you pull up an asset or when you add an asset, you can get a prompt for the procedures that are supposed to be part of that equipment. So when you go to schedule equipment, instead of having searched through your library of hundreds or thousands of procedures, you could just see the procedures that are needed for that particular asset category or asset model. And then, you set the date, click a checkbox, and you're moving on. We also have the ability to search right in the CMMS for those missing required procedures. So if it's a procedure that's required on that particular piece of equipment, that infusion pump, you want to make sure you have the annual and the biennial on there. You could search for ones that maybe have one but not both. So you could really let the system, if you set up the system right from the beginning with standards and procedures, you could use tools, you could do those searches to find out which ones do or do not have the right ones. And even if you don't have the tools, if you export it to Excel and just scroll through, you can see which ones are mismatched. You could filter and find this out other ways. We just like to build those things in to sort of help you out there. Here's a piece we talked, if we talk about those different risk assessments, Kevin was saying, if you assess everything by risk and then you have a good list of categories, you can check which ones have categories, which ones have mismatched categories. If you have the tools that are able to do that, you could look by your high risk AEM and make sure they do have the right procedures and stuff associated with them, and then drill down through the data to see which assets or which equipment doesn't necessarily have those things on them. You can see sort of, just an overview of how much you're compliant. Obviously, you want to be at that 100%, but when you have tens of thousands of pieces of equipment, in a large hospital, multi-hospital organization, how does somebody look at an overview and say, hey, and how do you break that down by hospital? Well, this hospital's good, but this one's only at 50%. So again, all those standards and all those things that are free text that you have in your system that Kevin will punish you for if you keep doing that, those aren't able to be analyzed in this type of manner. So, if you need to add categories to your list because you don't have the granularity that you have now, if you just have electrical surgical unit and you need to break that down a little bit more granular, make sure you add the categories or use the categories that do have those things. But it really sheds light. Again, it's all about compliance. If you don't have it scheduled, a work order is not going to show up and nobody's going to know that they have to go out and do it. So that's the importance of having that 100%. This is 100% schedule compliance, by the way, not your compliance on what you're working and what you're doing and what you're finding. This is, of the assets I have, are all of them scheduled appropriately. We may have fudged some of the numbers to make it not look so good for our demo, but that's sort of, something like that. If you could tie everything together, that really helps you determine sort of where you are in that process. So, the way we accomplish that and the way we accomplish it is we link those standards right to your data. So we talked about the regulatory standards, Joint Commission, ECO 20403, EP4, maintaining your sterilizers. As you can see, we were able to tie what procedures we're doing on those sterilizers. We have a scope annual at the bottom and a sterilizer quarterly. Those are the procedures that we have at our fictitious organization that we're doing, and we're conducting, performing tests to maintain that equipment. So when we link that item to the standards, what that lets us do is get an overview. So on the next slide, we're going to show you a report that once everything's linked together, go ahead and so flip it to the, you're able to see by the standard ECO 20403, by the EPs, I did highlight EP4 in red there, but you're able to see which months you're doing good in, which months you're not doing good in. And those dots, by the way, are clickable. I could drill down and see which equipment I missed, or which equipment's late, or which equipment's not complete yet, or which one had maybe some failures. But by the different types of equipment, I'm able to run this report. I could run this across my organization. I could run it for a single hospital. I could run it for different EPs. But this report gives you an overview of how you're doing. This is sort of the prequel to the books that we talk about. So keep that in mind as you're setting all this up. Everything does tie back to the standards, and you do want to make sure that you're able to do those. But that's something, like I said, that's a good overview. On the next slide, we're going to show you sort of how we manage the documents on a regular basis. We have a document manager built in, but this could also easily be just a drive on your network that you have access to, or another document management site. The key I want to stress is, though, keeping this all in one place and organizing it in a certain way. We have it organized here. I have some examples of MRI equipment. So if you are looking at your MRI equipment, we could put the EC and the EP on there. We tried to keep it so it wasn't totally Joint Commission, so we could show, DNV and Joint Commission type data in there. And you might have hospitals that are mixed. You might have a system where one hospital or two or three hospitals are using DNV and the rest are using Joint Commission, especially with all the acquisitions and mergers of hospitals. They can't switch immediately when you acquire them to a different system. So you might have a mix of both. So make sure your system accommodates that, and the procedures and frequencies you're doing accommodate both of those things as well. But the key is making it easy to find. If you could find it by EC or find it by type of equipment, such as MRI or imaging or your infusion pumps, that's the key in making sure they're in one place. And the same if you have a vendor doing it. If you have vendor documentation, if you have a service contract on a piece of equipment and they're doing the PMs, make sure you're getting those documents and putting them in the same place that you're putting your internal documents. That's typically where you, annoy, for lack of a better term, the inspector, because you have to go and find something. The more you annoy them, the more they're going to look for stuff to ding you on. So at least that's what I would do if I was a Joint Commission inspector or a DNV inspector. When you do look at those documents, you make sure you have your system has ways to tag those documents in certain ways, as compliance reports, what standard they adhere to, what building they're for. It does make it easier to find those things, like I said, and do that whether it's in a file format or a format on SharePoint or whatever system you're using, even in binders if you're printing them. Make sure you have a system that makes those easy to find. So tagging those with specific attributes makes that an easy thing. And then next we have a thing that automatically runs our compliance report. So this is the report we actually show to the Joint Commission inspector, and it gives you a summary of the procedure that was done, how many assets passed, how many assets failed. So if you're doing a lot of infusion pumps or a lot of different things that run around the hospital, you can do this by department, but it has the procedure, who completed that work order, how many passed, how many failed, and so on and so forth. So this goes right automatically into our document manager on a regular basis as you go ahead and doing those things. So that's just a couple things on the compliance. We're going to pass it over to Chris now to talk about the capital planning and financial components of this.
Yeah, thank you, Joe. So now that you have your data standardized and you're working and setting up your ITM schedules, getting your work completed, the next process is going to be, when do you need to replace and how do you plan accordingly for that? So a couple key questions that we see asked a lot with capital planning is, first off, do you even have an actual process in place to generate the capital plans right now? And that process could be anything we've seen from Excel spreadsheets of here's what we think we need, to who was yelling the loudest last time that I need a new piece of equipment in my department, or we need a piece here, or if there's a technician that mentions something more often, the squeaky wheel is often what happens, and how a capital plan is driven, we found. So is that process in place at all? And what kind of data is in there? So we believe that the data is the key to building a defendable and actionable capital plan. So a lot of that comes with the documentation we just talked about earlier. So are you documenting on the asset the date of installation? What's its life expectancy then? As Joe mentioned, are you continually updating its condition? So on an annual basis during your ITM cycle, are you updating its condition, even in a maybe a little bit more subjective way, technician, but do you have, hey, does it look right? Is it peeling? Is it cracked? Anything like that? And then can you track the replacement costs, even estimates, maybe by model number or type of equipment? Are you documenting then outside of the asset, everything on an ITM or even corrective, any type of work order, labor hours, and then costs to go with it? Do you have materials? Do you have service contract costs? Do you have external vendor costs? Everything around that. Do you have that documentation to create a defendable capital plan when you go to finance and say, here's the budget allotment that we're requesting? And then not only, oftentimes we've seen, you're not just budgeting for the piece of equipment itself, but you have to, depending on the piece, you have to remove the old, dispose of it, add the new one. Do you have to renovate in order to do that? Is there going to be some facilities or construction costs to go with it? sometimes buying a piece of equipment gets you something in a box in a storage room somewhere. How do you get it installed appropriately? So from there, we see it as we mentioned, tracking that actual information in the asset record. So are you flagging it as a capital asset? So not every asset is a capital asset potentially. But can you flag it appropriately? Do you tracking maybe even originally what was the purchase information from that? Did it come with a certain year warranty? You know, is it a 5-year life expectancy with a 3-year warranty? Are you, again, as Joe mentioned, you can update some of this, you know, replace or condition assessment and some of the other information directly from the work order. So it's not always an extra step. It's just part of the workflow and it's updating this. But these fields, some of them are being auto-calculated, you know, life remaining, when's the service line depreciation. You'll be able to have a lot of the information in there so you can track and better get the data needed to create the capital plan. And then maybe you need to schedule, depending on the piece of equipment, you need to schedule a different automated kind of asset verification work, or maybe it's part of just the procedure. But again, this is only one piece. So capturing the initial cost, capturing its replacement, extremely important. But then how are you analyzing the cost, the ongoing cost, to give yourself that total cost of ownership? So one is going to be labor. So adding labor charges, both for internal and external vendors, ideally. So internally, you know, you might have an average rate for a technician or a certain level of technician. You might not be specific to each technician you have, but are you tracking that time, capturing it, and then the cost that kind of goes with it? And then viewing that labor tracking in again, an analytics type platform where you can see our labor costs writ large going up, going down. You can then drill down by piece of equipment, type, category, everything that you've standardized on already to see, are my costs overall for imaging equipment going up, or pumps, or whatever it might be. Start to track and trend some of that, because that might inform maybe even, you know, vendor or model of equipment, being able to track, are my costs higher on a GE pump versus something else? And then when you go into capital planning, that'll inform maybe what you request, you know, depending on your internal systems. So, but then labor is one piece, materials are the other piece. So again, if it's from a vendor, getting that information into the system. But otherwise, are you tracking what material number, the part, the cost it was? You know, are you integrating maybe directly with something like a part source or another third-party vendor to pull, if you're ordering parts from them, how do you pulling that data in? So you're, again, getting the most accurate data for your total cost of ownership. Because that's really what you're going to look at to see, are certain pieces of equipment more expensive to maintain? Maybe I have 2 more years of life on a piece, but it's getting way more expensive to maintain than it should. Or maybe vice versa. Maybe it's not technologically obsolete, but there's other issues, you know, maintenance issues that are causing concerns, and you're not going to quite replace. Getting that data and tracking it all in one system is what's going to allow you to do that. Talking about the third-party vendors, that, you know, are you tracking your contracts? So how do we prevent, and this is kind of twofold, not only the cost that the contracts have, which is obviously important, how much are you paying annually or quarterly for service contracts with outside vendors, but perhaps there's a corrective that comes in for a piece of equipment. The system should be able to flag the technician that gets that say, hey, before you do this, there's a service contract. We're already paying somebody else to do this work. So make sure that it's, you know, make sure part of the terms is that you need to do it. Otherwise, the work order might just be a phone call to the vendor and to get them out. But have them acknowledge it. So maybe it's critical and it has to get fixed right away. So you say, yep, I acknowledge, but I got to do the work anyway. Or you could say, yep, I'm going to close this and I'm going to, you know, start an automation that's going to start a process that's going to call the vendor and have them come in. And, you know, obviously one contract might cover 1,000 or 2,000 pumps, or depending on the equipment, maybe your imaging contract with GE covers 40 imaging pieces of equipment. Being able to add those and make sure the asset cost is rolling up so that you know what that contract is covering and what it's costing you. And then how do we bring all that together? So I mentioned maybe that's a spreadsheet, but creating a more centralized place to get all the data. So analyze the cost history, the condition assessments, bring it all in to have the equipment really objectively seeing what should be replaced and when. So based off useful life, based off cost to replace, and then build a capital plan from that. So the capital plan module will allow you to have, you can see graphs for different areas. It could be for different types of equipment. It could be, you can create multiple budget years. So you don't want just at this point, maybe you're starting to plan for the 2025 budget year. But in the meantime, you're also thinking of your 2026, 2027, 2028 budget year. So you can start to look out to say, look, I might have a lower year this year, but I need to increase 50% for next year because of some type of event that you're anticipating. Providing this additional level of analysis and detail to your finance team ideally increases the likelihood that the budget request is approved as is. So getting that data driven, and again, it takes it away from who's yelling the loudest in finance meeting to, this is not me saying it, this is data saying we need to replace this equipment, this is why it needs to get done. So move out of the spreadsheets, move out of that type of more something, it's been described to me as emotional based meetings and decisions, and provide it with data. So having that data in your CMMS, everything that standardizing it as Kevin laid out, and creating the process to document appropriately as Joe laid out, will provide you at the end of the day kind of a seamless process into a capital plan that you can then share. Again, specific to your equipment, you can share up with your finance as you're going through the process. So that capital planning really comes down to evaluating that data that you're already tracking against what's going to be needed for finance, ensuring that it then aligns with those requirements and the process is there. Annual maintenance is a good time to review its condition. So the technicians are touching this equipment every year anyway. You don't have to, they're finding it as part of their ITM process. So it just becomes another checkbox, as Joe showed, on their procedure list. Getting all those costs in there, capturing everything, including the installation fees, the disposal fees. Maybe sometimes you have to pay to get rid of things. Capturing the full amount, because a fictitious number. Let's just say you want to replace an imaging equipment, it's $1 million. Well, that just gets you the equipment. Then you need to remove the old one. You need to install the new one. You need new electrical. So maybe that's actually a $3 million project. Being able to appropriately plan for that is key to be able to get exactly what we're going to need back out. So with that, again, we appreciate everyone's time today. If there are questions, please feel free to use the system, ask here. You can obviously also email us, sales@fsiservices.com. I'll also plug Joe, Kevin, and I will all be at AMI next month. We're in booth 717. Hopefully it'll be hard to miss us. So please come by, say hello, ask questions there as well if you'd like. But I'll open it now to any additional questions.
Perfect. Thank you so much, Chris. We've got a few questions that have come in. I'll get through as many as we can. The first question is, how do you manage asset service contracts?
I'll take that one. Chris sort of pointed that out a little bit in the contracts module. We actually do it in a couple of different ways with our software. One is at the asset level. You can add multiple assets to a single contract, and that pops up the little warning, so you don't accidentally work on something that's under contract. We also do it by location. So if somebody says, hey, we're just going to handle all the equipment in this doctor's office or MOB building or MRI center, you could, rather than flagging all the equipment there, you could do it by the location as well and handle the contract there. With that, we're tracking the cost of the contract, the terms of the contract, what they cover, what they don't cover. That piece Chris showed earlier is actually configurable. So maybe they cover the imaging equipment, but they don't cover certain other types of equipment. You could spell that out directly in the item, or maybe it's they cover the parts only, but you have to pay for the labor. So those are things you can warn the technician about prior to going into those. So a number of different ways we handle the contracts.
Okay, perfect. So what mobile devices do you support?
Mobile, we support Windows, so any Windows mobile device that's running Windows, so a Surface tablet, and then also the iOS tablets and phones, so your iPhones, your iPads, and then your Google tablets and phones as well.
So what other software do you integrate with?
Yeah, great question. So we integrate with, I mean, a number of other vendors. We integrate with Scenario and similarly on the cybersecurity. We integrate with AirScout on RTLS. We've also, I believe, Midmark as well. And there's a few other RTLS systems. We integrate with Fluke and their answer testing devices. That's just a handful off the top of my head. There's many more. There's a longer list. You can actually on our website. There's another kind of list there, and we also have an open API, a public API. So we've been able to integrate with a lot of other vendors as they come up.
Great. So is there a limit on the number of assets you can track?
We do not have a limit. Yeah, we could put. I never put more than 10 billion in, but I'm assuming we could handle 10 billion. So.
Okay, just leading on from, do you have any customers currently utilizing the system to this level?
Oh yeah. Yeah, we have a number of clients using the software exactly kind of as we described that, we kind of take them through a standardization process. We can, if interested, we can provide references and discussions around that as well. But yeah, absolutely, we do have each of the modules you're looking at here are modules that are currently being used by our client base.
Okay, so how do you track equipment recalls and alerts through your asset management system?
That's currently tracked via the software, via the asset itself. There's not an integration currently with ECRI, but we can be able to go through and do searches on those assets and document the hazard recalls and be able to create work orders on those. Joe, did you have something else?
No, that was it. I just wanted to point out with ECRI, they are updating their platform, so we're in line. Once that's released from ECRI, we'll be able to better plan out that integration. So, but we were late to the party with them, and they weren't doing any integrations to their current system without that new API. So.
Okay, and another question that's come is, what capabilities do you have for incorporating clinical criteria for replacement forecasting?
With replacement forecasting, we have a couple different ways we do that. One, we do it by the condition. The condition of the equipment is sort of the big flag. If it's in, if somebody flags it as needs replaced or can't get parts or something along those lines, that's one of the things as well. But the benefit of having it right in your CMMS is, and you're doing those repairs, we're able to capture the cost that you're doing non-preventive maintenance on. So if you constantly keep getting a piece of equipment in that you're constantly repairing, you're able to see that piece of equipment's a lemon, so to speak. So when you go into our capital planning module, you're actually able to see the number, which piece of equipment has the most number of corrective work orders done and what that's costing. And then you can look at that versus the replacement cost and make those decisions in a little better way. That's if you're doing it in Excel, you could do those searches manually to find that stuff, but if we just have that built right in. So those are sort of our bigger criteria. And also if it's near end of life, that's the other factor. So if you bought the equipment in 1980 and the end of life is 10 years, it's going to show up on every time you look at equipment on end of life because it's very old equipment. So that's another factor in determining what those is. So as long as you're setting up a system for success, let the tool help you make that decision rather than having to go hunt for that information. We just have actually tabs across our screen that you pick on those 3 items and you're able to see which equipment show up on the list. And if it shows up on all 3, then you're probably due for a replacement.
Okay, another question here is, how is the installation data managed for assets that are reallocated within the health system?
I'm trying to think, can you ask that again one more time?
Yep. How is the installation data managed for assets that are reallocated within the health system?
I think they're talking about the transfer of assets between different facilities. Is that kind of what we're asking about? We have a transfer mechanism in there that if assets move from one facility to the next or different segments, we can transfer them within the application and be able to track that if we're answering your question appropriately.
Okay, I'm sure any attendees will contact you with any further questions anyway. So another question here is, what are your recommendations for replacement cost data?
Yeah, so for replacement cost data, there's kind of a couple different areas that you could get that from. And this is from experience talking with clinical engineers. They either kind of go through, there are some vendors like Itania is one that provides that kind of data. There's also others, sometimes there's a relationship where the replacement data comes from. There's also, I've seen some hospitals just take what they paid, especially because oftentimes they're buying somewhat regularly, especially larger systems, and then they'll put, all right, we're going to budget 10% more for 2 years out, or something along those lines. But the most often, and this is from when we were building capital planning and talking to our clients, is they often just kind of on a regular basis will talk to their vendors to get an idea, and then using some of our mass edit tools will say, all right, all these pumps, this is the new price that, you know, the replacement cost on them to keep it more up to date.
Okay, perfect. We've got time for one more question. Now, how are you using AI?
We're planning our AI strategy around, you know, making the software easier to find the information. You know, probably our first foray into the AI world is going to be rather than having to do a search and look for these pumps and, you know, the ones that are in bad condition and, you know, fill out the form manually. How do you make that a smarter search? You know, either through talking, asking it, show me all my infusion pumps that I should replace. You know, or typing that out is probably the more realistic approach. So that's one of the areas we're looking at. We're also looking at when the data becomes available, specifically on the, you know, with, you know, a biomed engineer needing to understand how to repair up to 3,000 different types of equipment in some cases. How do you make that process easier? How do you make finding that process easier within the system using AI? There's just not a lot of data out there to go find and search on that information, but as more data becomes readily available, you know, what did you do to repair this last time? What parts did I get? Those are things we can get through with our data. And we're looking to start with, you know, current, you know, within your own system. And then we're looking at benchmarking, you know, anonymizing that data to see how the industry is performing in those same areas. Again, another importance of standardization. If you could all talk the same language, you could actually compare, you know, apples to apples when you're comparing, you know, how somebody's doing it at one hospital system versus another. But we're being mindful of that with different HIPAA requirements and different other things within the healthcare organization. So we're treading that lightly, but it, you know, searching within your own data is probably our biggest rock we want to hit there.
Perfect. We are approaching our hour, so if any attendees have got any further questions, please email the team at sales@fsiservices.com, and I'm sure they'll be pleased to help you. So thank you so much, Joe, Chris, and Kevin, for your time today and for a great and informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the services they provide to the industry. So please visit fsiservices.com. As promised, the answer to today's trivia question is purple. So congratulations to our winner, Daniel Griffin, who is in Tennessee. So Daniel, enjoy your gift card. And just a quick reminder, you can attain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. If you've missed any of our past webinars, including any by FSI, please visit webinarwednesday.live to view our whole webinar archive. We'll be back next week with another webinar and, of course, another 10th anniversary prize. So please visit webinarwednesday.live for more details and complimentary registration. Thank you once again for your time today, and I hope you all enjoy the rest of your day and hope you have a great Memorial Day weekend.